Hello and welcome to this special series Jal Daan, Building a Healthier India. In this series, we're going to focus on the importance of clean drinking water and how it's imperative to make it accessible to all. Network 18 has started this campaign in association with AquaGuard, and Jal Daan is all about creating awareness about this nationwide problem and an endeavor to find implementable solutions that will make a real difference. Through this campaign, we encourage citizens to take a pledge and indeed go out and donate at least 5 liters of clean drinking water every day to someone who doesn't have access to this basic necessity. So how do you take these small steps towards creating a healthy India? Can simple solutions like the installation of water treatment plants, whether it's in urban slums or in rural areas, be implemented? Can the government, the corporate sector and NGOs join hands with citizens to make access to potable water a watertight reality? To discuss and deliberate on all this and more, I'm joined today by an esteemed set of panelists from across the country. Here in our studios, we're joined by Dr. Tupil Venkatesh. He's Professor Emeritus, Department of Biochemistry and Biophysics at the St. John's Medical College. Dr. Sriram Nene is a medical expert joining us from Mumbai. Rohini Nilekani is founder and chairperson of Argyam. She's joining us from Bangalore. V.K. Madhavan is Chief Executive of WaterAid India, joining us from Delhi. And Parameshwaran Iyer, who's the Secretary of the Ministry of Drinking Water and Sanitation. Thank you all for joining us here on this special program. Let me start with you, Dr. Tupil. How do you see the problem of drinking water in India? How grave is this issue?
Very pertinent question as an situation exists today. And water is one thing which is worshipped by people of all faiths all over the world. If you take one of the most ancient civilizations, we used to worship water as we are nature worshippers. Yes. We used to say, Apo Vanna Bhava, Apagnanaha, Apashaktihi, Apamrutaha. Water, you are the God, you are the life giver, you are the energy, you are the source of knowledge. But same water today across, whether rural or urban, is now endangered with regard to quality. The same water which is supposed to give life, protect life, has become some kind of a poison contributing towards various diseases, whether it is a rural population, urban population. In urbanized area, more of toxic minerals; in rural area, more of organisms causing health hazards. This is the situation today.
I'll come to the contamination bit in just a moment, but let me start off by asking you, how do you see this problem of drinking water in India?
Look, obviously drinking water is a pretty basic service, and so it's very important for the central government as well as the state governments. Now we have a program called the National Rural Drinking Water Program, the NRDWP, which is one of the major centrally sponsored schemes in the government. It's done on a 50-50 sharing basis with state governments, and we have a budget this year of about 5,000 crores. And we are likely to get a little bit more to address the issues of water quality, which are the top priority for the government.
Dr. Nene, in terms of people's ability to access clean, potable, treated drinking water, how big a problem is this according to you?
As a heart surgeon, we were always taught, 70% of the body is water, and while you can forego food for a week, you have to have water on a daily basis. And so when it comes to the fact that water comes from the clouds and it's fairly sterile at that point, what happens to it along its journey beyond that becomes an issue for all of our populace. And so when we talk about 690 million out of 1.3 billion people, the problem is obvious.
Rohini Nilekani, you and your foundation have been working for a number of years on water-related issues, particularly on groundwater-related issues. Again, why is it that in our 70th year there is still a lack of access to clean, potable drinking water?
Yeah, 70% of India still gets its potable water from groundwater sources. And Zakka, one of the problems with groundwater is that it is invisible. And so you don't really know what's happening underground in the aquifers where the water you're drawing up is from. And although the Indian government has done a great deal, and all the state governments have done a great deal to bring water to people, where we have had issues of quality having been addressed, we've had quantity issues cropping up, which again lead to quality issues. So, you know, it's been hard to keep up with the growing needs of the Indian population when it comes to safe, clean drinking water.
That's right. And I'd like to take that question to Mr. V.K. Madhavan from WaterAid India. I just want you to put this into context for our viewers as to how grave this lack of accessibility to water, such a basic commodity, is in large parts of India.
So we have a serious problem with access to drinking water in this country. If you were to look at households, particularly in rural areas, which have access to safe drinking water, it would be less than a fifth of households in our country actually have access to safe drinking water in rural areas. But if you were to look at mobile phone penetration in rural areas, you'd find that 41% of households have access to mobile phones. So we have a strange situation where you have great mobile phone connectivity, but yet we've been unable to provide households, particularly in rural and urban areas, with access to safe drinking water.
You know, I want to go back to Dr. Nene, and you referred, Dr. Nene, about contaminated water. The World Health Organization estimates that in India, close to 40 million people are affected every year because of waterborne diseases, a large majority of them children. Could you throw some light on the lack of quality water, even for the ones who have access or who are fortunate enough to have access to water?
When you're dealing with groundwater, the potential for contamination at its source as well as along the way is very large. On top of that, you also have other types of contamination. But with the 40 million, this leads, in effect, to some estimates of almost 400,000 to 1.5 million people dying. The majority of these are often kids. 75% of these 40 million are often kids because they are susceptible to these diseases. So I think in order to attack the problem, you have to attack the source, which is on multiple levels. The government has made huge strides in the direction, both this administration and others, towards Swachh Bharat, towards other things. And I think the public-private partnerships are what are going to change this. And more importantly, the individuals joining hands and saying something like Jal Daan, where everyone takes responsibility to help those who don't have the type of water they need.
All right. You know, I just want to get one more word in about contamination, particularly mineral contamination. You are referred to as the lead man of India because of the extensive research you've done on lead contamination in water. Are we any closer to having conquered this problem, if I can use that?
Yes. Our earlier studies with Quality Council of India, we found that a majority of cities where we get drinking water, whether municipality water or the groundwater, were found to contain unacceptable level of lead in that. Now, the lead in water is the most vulnerable group, is the women at the reproductive age. The women, you know, when they consume either food or water contaminated with lead, which is very common now because we have thrown enough lead all around, this is going into our system. There is no placental barrier, it goes into the fetus. There is no blood-brain barrier, goes into the brain. And child which is born will never become a Buddha, will only become a Buddha, you know, with a reduced IQ. This is the problem.
Let me also take that across to Mr. V.K. Madhavan in terms of how technology can be a game changer in making such a large population, getting them access to clean drinking water. Do you think technology can help us leapfrog this quench?
I think there's a role that technology can play in being able to crowdsource information about water access, water quality, right across the country. I think it's also important to recognize that the choice of technology has to be based on testing of water. In other words, technology can't be the driver of solutions. We have to actually ensure that we're able to test the water quality on a regular basis, and based on the results, we choose what technology is appropriate for a particular area.
In terms of, and you referred to this in your previous answer as well, Dr. Nene, about how technology can play a role in providing potable water, particularly to a population as large as India's.
I think technology fundamentally can leapfrog us ahead, and I believe it can be done on several levels. As was pointed out, 41% of India has access to mobile phones and WhatsApp and other types of applications. If we could just integrate that with a monitoring system, either IoT or something like that, we could easily figure out where water was going, where it wasn't going. And particularly now with some of our initiatives, I don't see any reason why we could not join hands and get this up to speed quickly.
On that note, we're going to slip into a short break. When we come back, we will talk more about reaching out to communities and technology as a key enabler to provide clean drinking water to rural populace. We'll come back right after this short break. Welcome back. You're watching Jal Daan, a campaign by Network 18 in association with AquaGuard on making clean drinking water accessible to all. If I can come back to you, Dr. Topal, in terms of community outreach and getting community stakeholders involved in a project and make them long-term sort of participants in these outreach programs, if you could spread some light on that.
Yes, the National Referral Center for Lead Projects in India launched a 3-stage program all over the India, involving local organizations, educational institutions at grassroots level, schools and school teachers, creating much needed public awareness. First, awareness was created, keeping the technology also available. Same time, we did not want to create fear, saying that the drinking water has lead. That would have created a fear amongst them. We also gave them the simple technology, thanks to the Eureka Forbes for coming out with the technology of providing lead safe water. Even at the rural population, we have very successful stories in cities like interior of Mangalore and in Andhra, where people demonstrated that the school, the cognitive function amongst children who were drinking only this safe water was much, much better.
All right, it's interesting. So, Rohini Nilekani, in terms of how you can get a collaborative approach, I was trying to ask you this about, it's not just government alone that can lead this, and you through your foundation are very well aware of how you can make local communities stakeholders in long-term projects. Can you share some of your experience with our viewers?
In Kerala, many households have wells. But even in Kerala, unfortunately today, many parts of Kerala are actually facing summertime drinking water issues because of drought. So one of the programs that Argyam's partners and supported with the state government of Kerala was to do roof rainwater harvesting and have that water directly go into the wells of the households. And with that, a lot of the people found that their wells did have water even during summer. I think by using simple but easy to carry out kind of interventions, I think we could together solve our drinking water problems. But there are other issues too, Zakka, which we have to worry about, and that is fluoride, arsenic and industrial effluents getting into people's drinking water. And we really need to come together pretty quickly to solve some of these things, though I do believe they are solvable. We just need to have both the political will and the public will to get together to solve them.
In your opinion, Mr. Iyer, what kind of collaborative approach, after all, government alone cannot achieve all of this, what kind of collaborative approach is required to achieve the objective of providing clean drinking water to all citizens in India?
So while it's mainly the public sector, typically the public health engineering departments in states or the water corporations, which are responsible for delivering water in rural areas, it's also important to partner with NGOs and civil service organizations. There are good examples of this, in particular because they have better outreach and they're also doing a lot of community development work. So there is an example, for example, Rohini and her team in Argyam are doing very good work in Karnataka in particular. WaterAid and other NGOs doing work in many states, and even the Tata Trust is doing work in Uttarakhand and many other states. These are just some examples. But I think we actively encourage states to partner with local organizations to make sure that services are delivered to the last mile.
When in a country like India, we have 265,000 Grama Panchayats, where we started Gram Panchayat accreditation. Every Grama Panchayat has responsible people at grassroots level. They have their own water, local water source. Can they not sustain, can they not use simple technology to assure they need not import water from some other place? Whatever they have, we should educate them, provide them the technology. So that's what we are aiming at, providing sustainable, self-operatable technology with which they get safe water for their children and their grandchildren. Then the whole country is safe.
Okay, let me also take that to VK Madhavan. You know, how important is water management, even before we begin to talk about clean drinking water and accessibility to clean drinking water?
So there is a need to look at water security from the perspective of water being used in a judicious manner to ensure that water requirements for drinking are met. In other words, water requirements for life are first guaranteed, and then we look at water then being used for livelihood purposes. I think it's also important that we should start to look at the need to augment the groundwater.
And Dr. Nene, as we sort of round up this discussion, let's talk a bit about Jal Daan, this campaign. The idea of letting individuals, particularly the fortunate individuals, to contribute 5 liters daily. What sort of impact, both at an awareness level and also at the level of spreading this program far and wide, do you think this will have a campaign such as this?
I'm very confident that something like this, it already has made a difference. And we talk about technology, we talk about everything else, but in the end we're a democracy, of the people, by the people, for the people. The government can lead, but we as a population have to be galvanized to doing the right thing. And I would say a small donation of 5 liters makes such a difference in people's lives, whether it's someone who is in your immediate life. And I think every single one of us have stories about people who work with us, who work for us, whatnot, and how just a small gift of water and the ability for them to get clean water every day makes a huge impact in their lives and their children's lives.
How is the government partnering with non-governmental organizations, foundations, voluntary enterprises to try and encourage community participation in the clean drinking water mission?
Sure. As I said, this is pretty much a basic service which needs to be provided, and the central government provides policy guidelines and funding to state governments, and state governments in turn take it further downwards. But I think what is important is that there's a collaboration between the public sector, local NGOs, community-based organizations, and I think different institutional models need to be tried to make sure that it's not a one-size-fits-all, but they're working in partnership with different organizations to deliver at the end of the day better services in terms of clean drinking water to the rural population.
Rohini Nilekani, you want to take that as a closing comment?
We've had hundreds of years of a culture in our civilization where people used to keep a little matka outside their house so that any passerby in need of water would never go short. Every house kept drinking water outside their gate so that any passerby, even all strangers who needed water. While the state has the responsibility to make sure nobody lacks water, I think encouraging people, especially people who don't have to think twice about the water that they drink, to know that just in their neighborhood there are people who may not have safe water, and making them feel a little more responsible, I think is a good thing to do as well. So I wish you luck in that campaign.
All right, thank you so much for that, Dr. Tupil.
I tell you, it is when somebody donates a pint of blood to a patient, he saves one life. When through this Jal Daan, there is a life of the family saved, health is preserved. It is not just Jal Daan, I would like to rename it as Jal Daan is also a Jeev Daan and a Shrestha Daan which we can ever think of. Thank you.
Thank you so much for joining us on this fascinating conversation as we begin this campaign, Jal Daan. And you, our viewers, could also extend support to Jal Daan and contribute to the cause. You can pledge your support by donating 5 liters of drinking water every day to somebody who needs it. You can log on to websites and take that pledge. And if you know of individuals or organizations who are working towards making clean drinking water accessible to all in their own little ways, then do share those stories with us using the hashtag Jal Daan. Keep watching CNN News 18. Thanks for your time. Goodbye.